let's continue our discussions now around World Mental Health Day. Bring in the Teddy Bear Clinic. Joining us now to speak about children's mental health and the importance of supporting these young ones who are facing unimaginable challenges in some instances. Our guest is Dr. Shaheda Omar, Clinical Director with the Teddy Bear Clinic for Abused Children. And Dr. Omar, welcome to the SABC. Great to be speaking to you as always. And, you know, as it were, today's observance of World Mental Health Day comes at a time where, let's face it, South African children are facing incredible challenges. No less the 5 who have just died in Naledi after being subjected to goodness knows what, quite frankly, because we're still unsure, but it's suspected to be poisoned food from a local spice shop. That instance alone raises so many issues around ways in which perhaps we continue to fail this country's children.
Indeed, Ayanda. I think if we look at the landscape of South Africa, who's our most vulnerable and marginalized population group? It is our children. They are subjected to so much violation, so much trauma. And if we look at the Center for Disease Control and Prevention, we are finding that 1 in 6 children between the ages of 2 and 8 years old are presenting with a mental, behavioral, and developmental disorder. And what we have seen since COVID-19, mental health has become, it's actually reached pandemic proportions where we are seeing young children as young as 9 years old, subjected to depression, anxiety, and even completing suicide, something that we haven't actually seen in the past few decades, where more and more children see suicide as the way out. And a lot more children are displaying behavioral disorders within the school context, within the home context, where we are presented with, as I mentioned, anxiety disorders, depression, the attention deficit hyperactivity disorder, obsessive compulsive disorders, eating disorders, post-traumatic stress disorder, which is relevant to our context and globally as well, where children are exposed to violence, whether it's domestic violence, neighborhood violence, even global violence in terms of the wars that we are currently faced with, where children are being exposed to this on national media and often not in a position to process that, fearing for their own security and safety, but also looking at the autism spectrum disorder. I think these are a lot of the challenges that we are faced with, and many children, as we speak, struggle with sleeping disorders, struggle with eating disorders. So children are not in a good space because we are seeing that children are often labeled as bad, as mad, as children that are, stupid sometimes, or lazy or silly. And what mental health does, when there's poor mental health, it actually prevents children from developing healthy, positive relationships, but also achieving academically and even socially, where they withdraw, isolate themselves, and manifest concerning and worrying behaviors. One needs to look at it in context, looking at duration, frequency, and severity, because we know that many children, just an isolated incident does not mean that the child has a mental health problem. However, if there's frequency in this, and of course, if the child is displaying excessive fear, worries, and children that cannot sit for a minute, for a second, and there's motion constantly, those are alert signs that one needs to look out for. And low energy, and something most important is self-harm. We're seeing a lot of children maybe wearing layers of clothing on a hot day, but also cutting themselves on their inner thighs, their upper inner arms, on their chest, where it's not visible to the naked eye. So these are all, or some of the manifestations of mental health challenges that we are faced with in this country and, of course, globally as well.
Yeah, you've touched on this already, but I think it's worth really going into some of the details. I mean, in the case of adults, sometimes it's difficult to articulate how you're feeling and therefore allow for a diagnosis to take place. I imagine the challenge is even much more difficult for children, right? Especially in instances where their behavior is being misdiagnosed as mischief, when frankly it could be something way more serious.
So I think you've touched you've hit the nail on the head, because often it's misdiagnosed. And what we what we refer to them is these misunderstood children. Because of the lack of skill, the lack of training, we find that children are going through the academic institutions labeled, in a very negative fashion. And this only feeds into the low self-esteem, negative self-esteem, and perpetuating this kind of behavior because they are not diagnosed appropriately, accurately, and even timelessly. If we look at our infrastructure, yes, we have psychologists, school counselors, but if we look at the ratio of the resources that are available to children, it's disproportionate. The roll numbers are so large in classroom settings, and even for the resources to reach out and be effective in their interventions, in their assessments, it's actually a very difficult and challenging situation to reach out to so many children. So often children are falling through the cracks and continue to be labeled, and we find a generation of children who are dropouts, who are displaying delinquent behavior, oppositional defiant behavior, and this is what we have to deal with because children are not, their symptoms are not identified timelessly, and of course people are not skilled or empowered or equipped to manage it.
Yeah, there's a saying that I've heard before that's really stayed with me, and I'm not sure if it's a saying that's used usually in psychology, but it goes something along the lines of hurt people hurt people. And I'm only mentioning this because, the reality for many children is that the harm that befalls them is as a result of adults who themselves probably need a lot of support. I imagine we can't have the one conversation without the other.
Indeed, and if we look at observational theory, learning theory, where do children learn their behaviors? Who do they identify with? Their role models, their icons, their reference groups. Those are the people that children identify with and emulate, and I think just looking at the fact that you said, the important thing is aggression begets aggression. And when children are not heard, they continue to hurt because they are expressing themselves in the ways they know they've been socialized in, and as a result perpetuate this cycle. And that is something that we need to address because that is the shortfall or oversight of children, of understanding children's behavior.
Yeah. Are we doing anything right, Dr. Omar? Is there, a beacon somewhere that we can hold on to, an example that we can try to emulate about how to respond to what's taking place? I shudder to create an impression that it's all lost.
So it's not all lost. I think as we speak at this very moment, what is important that South Africa is going to be participating for the first time in the ministerial global conference of ending violence against children. This will be hosted in Bogota, Colombia, and there's going to be a ministerial delegation. This ministerial delegation has actually consulted with children. I'm part of that consultation group where nothing about us without us. So children's voices have been amplified and they have pledged a call to action. And that is going to be presented at the Bogota conference. I think hearing children's voices for the first time, there's a 7th pillar on the National Strategic Plan where it addresses children's voices. In the past, if we look at gender-based violence and femicide regarding the National Strategic Plan, children's voices were diluted. It was violence against women and violence against children. Children were actually not brought to the fore, and it was, the voice of the voiceless, certainly giving a voice now to the voiceless. So, and I think important thing here is that we are finding there's more collaboration, coordination, and integration of government departments and civil society addressing the challenges and needs of children. A lot of work needs to be done. It's work in progress. But if we just look at the past 2 decades, we have made some progress.
And hopefully we can continue to do so. Dr. Shaheda Omar, always great getting your insights on these issues. Thank you so much for speaking to us. Dr. Omar is, of course, the clinical director with the Teddy Bear Clinic for Abused Children. All right, we'll continue with our mental health focus in just a moment.